Guests this morning. My name is Cathy Levine. I'm the Executive Director of UCAN, Ohio. And we're here today because dental health is a critical part of overall health. And the lack of access to safe, affordable dental care is a critical access problem in Ohio. Dental Access Now is the campaign we're launching today. Dental Access Now is a statewide campaign to bring quality dental care to every community. The campaign will educate the public and policymakers about the health ramifications of lack of access to quality dental care and propose solutions to expand dental care to more Ohioans. Dental health is Ohio's top unmet health need, according to the Ohio Department of Health. Access to affordable dental care is beyond the reach of too many Ohioans. Despite the fact that oral health is essential to overall health, nearly 1 in 5 Ohioans do not have dental insurance. Many Ohioans must choose between dental care and other daily living expenses. In addition to the cost, many Ohioans simply live where there are no dentists available. Ohio has 57 federally designated dental health professional shortage areas. 57. Mostly due to inadequate numbers of dentists to serve the rural and urban low-income patients. There are several types of dental health professional shortage areas, but all have high ratios of patients to providers that leave a community underserved. At least 850,000 Ohioans live in these federally designated dental shortage areas. But the actual number is probably far greater because many areas in Ohio have not sought federal designation, but still have a dental shortage. In Franklin County, we have 2 designated dental shortage areas and 3 health centers that do not have enough providers to serve their patients. Clinics often keep long waiting lists and cannot keep up with the need. Lack of access to dental care is not just a child problem or a senior problem. The lack of dental practitioners and affordable dental care impacts people of all ages in Ohio. Consider the following. 3 times as many Ohioans lack dental insurance as lack health insurance, an estimated 3.6 million people. 60% of Ohio seniors 65 and older are uninsured for dental care. About 40% of children and 30% of non-elderly adults, and only half of seniors enrolled in Medicaid saw a dentist in 2008. Let me say that again. Only 60% of Ohio, only 40% of children, 30% of non-elderly adults, and only half of seniors in Medicaid saw a dentist in 2008. Half of Ohioans had at least 1 tooth removed due to tooth decay or gum disease. 6% have had all their teeth removed. This should be an embarrassment to our state. 25% of third graders have untreated cavities. This dental shortage has the biggest impact on the most vulnerable Ohioans. Only 50% of Black and Hispanic residents had a dental visit in the past year, compared to 60% of non-Hispanic white Ohioans. Just over half of Ohioans living in the Appalachian region, and only 60% of rural Ohioans had a dental visit in the past year. Dental care is one of the most needed services for people with disabilities. Lack of dental care can lead to many greater health problems. Oral diseases ranging from cavities to oral cancer cause pain and disability. Untreated dental decay in young children can lead to improper nutrition, delay in speech development, pain, school absences, the inability to concentrate in school, and set the stage for a lifetime of poor oral health. Gum disease is an infection that's caused by bacteria that gets under the gum tissue and begins to destroy the gum and bones. Besides the damage to teeth and gums, gum disease may also lead to damage in other parts of the body. Recent studies link these infections with diabetes, heart disease, stroke, and premature and low birth weight babies. As a state, we spend far more to treat health complications caused by untreated cavities and disease than we do on the cost of regular preventive dental care. Joining us today is Raquel Rios, who has experienced firsthand the difficulty of not having timely access to dental care. I'm going to ask Raquel to share her story now. Thank you, Raquel.
Hi, good morning, everyone. My name is Raquel Rios, and I am a Columbus resident. I'd like to share some of my personal experiences with you today so that you may have an idea of the barriers that many people in this country must overcome in order to get the dental care that they need. My family immigrated to the United States when I was 5 years old, and during the 17 years that I have lived here, neither one of us has ever been able to afford dental insurance. When I was 6 years old, I slipped in the bathtub and broke most of my baby teeth. My adult teeth grew oversized and very crooked. I remember not wanting to smile in photos because I was ashamed of my Bugs Bunny teeth and the gaps between them. Without dental insurance, my parents could not afford to get me the dental care I needed. Eventually, my mother found a man who got his dentistry license in Latin America and charged very little for his services. He fixed my crowded mouth, performing extractions in his home garage. And with the help of my very generous uncle, an orthodontist, my teeth were eventually straightened. But after that work was completed, we couldn't afford regular routine cleanings or dental exams, which can cost hundreds of dollars without insurance. So for 10 years, I did not have a single cleaning or dental exam. Knowing that routine care was out of reach, I made it a habit to practice excellent oral hygiene. Flash forward, when I was 19 years old, I had to have my wisdom teeth removed. In order to afford the procedure, I had to get a credit card specifically for dental care. The interest rate on the card was 29%, and it took me 15 months to pay the bill. My senior year of college, my university offered us a discount plan that would allow us to afford some routine procedures at a dental office. After paying $25 for the yearly discount plan, I was able to afford a checkup, including x-rays, and a cleaning for $85. I was told that was a bargain. The dentist informed me that I had 8 cavities and asked me about my diet and oral hygiene. But once he found out that I hadn't had a routine checkup and cleaning since I was 10 years old, he was actually quite impressed that I wasn't in a worse state. Given how hard I worked to maintain good oral hygiene, I was so upset to learn I had that many cavities. I knew I had to get them filled before things got worse, but the dentist informed me that with the discount plan, one cavity would cost about $125 to fill. As a college student with absolutely no money, that was just something I could not afford. That year, during our spring break, I returned to my native land of Nicaragua for the first time in 17 years, not necessarily to see my family, but to see a dentist. I managed to get all my cavities filled at the cost of $10 a cavity, even including the cost of the flight. Flying to Nicaragua to get my cavities filled was much more affordable for me than having the work done in the U.S. I was relieved and so grateful for the excellent care I received there. These days, I suffer from chronic tooth sensitivity. I went to see a private dentist and he concluded that I need a custom mouth guard because I grind my teeth at night, which is a common consequence of stress. The mouth guard, he said, would cost $300 to make. Considering it took me 3 months to pay the $165 emergency visit to his office, a mouth guard is clearly something I cannot afford. Despite all this, I feel very lucky because I overcame many barriers in my life to get the care I needed. And today I'm able to eat, speak, and smile with confidence. Unfortunately, this is not something that everyone who lacks dental care in this country can say. Thank you.
Thanks, Raquel, for sharing your story and helping us to put a face on the need for improving access to affordable, safe dental care in Ohio. We've told you about Ohio's lack of access to dental care and the health problems that follow. I'm sure you're wondering what we plan to do about it, and we didn't call you all here today to just complain about a problem. Dental Access Now is proposing that Ohio embrace a promising approach to expanding the dental health team by adding mid-level dental health practitioners to the dental team. Ohio can begin to address the lack of access to providers while expanding affordable care in underserved communities. The mid-level dental health practitioner, or dental therapist, can expand the reach of dentists and provide primary prevention services and routine fillings and extractions. Dental therapists would be able to expand the availability of basic reparative services to socially disadvantaged subpopulations, engage caregivers whose social background and cultural experience match those of targeted populations, establish a career ladder for unrepresented minorities, improve cost effectiveness in educating providers of basic care and purchasing dental care, and strengthen the safety net. Based on models in Alaska and in countries like England, Canada, and New Zealand, dental therapists can provide high-quality care. In October, a comprehensive study of Alaska's dental therapist program was released. The evaluation assessed the work of dental therapists in 5 communities, as well as the experience of hundreds of patients and how dental therapists performed on hundreds of procedures. Key findings of the evaluation indicate that dental therapists are competent to perform the procedures within their scope of work and are doing so safely and appropriately. They are consistently working under the general supervision of dentists. They are successfully treating cavities and helping to relieve pain for people who often had to wait months or travel hours to seek treatment. And patients were very satisfied with the care they received. Dental therapists would be trained and educated in a certified program and would practice under professional supervision. The training for dental therapists can be community-based with programs housed at community colleges. Training program models include more than 3,100 hours of training, followed by 400 hours of preceptorship before being approved for certification by a dentist. In other words, the dentist works closely with the dental therapist before approving the dental therapist to work remotely. Training is substantially less than the cost of educating dentists because it can be done over the course of 2 years plus the preceptorship, and therefore can make routine care more affordable, saving the highly trained dentists to perform more serious procedures. As we launch this campaign across the state with providers and consumers, we look forward to educating communities and policymakers on how the dental therapist model can help to close the gap in Ohio's dental care needs. And I just want to recognize some of our campaign partners here. We have Jessica May from the Ohio Association of Second Harvest Food Banks, which represents the state's food pantries, and also operate the Ohio Benefit Bank, and they see firsthand the tremendous criminal lack of access to routine dental care throughout rural and urban parts of Ohio. And Janet Miller from Ohio Cerebral Palsy Association, representing the disabilities communities, which also suffer. People with disabilities have a far harder time seeking a dentist. So I want to thank you all for being here, and we'd be happy to answer any questions.